Hello, my name is AKusz, and today I'm going to be doing my presentation project on anorexia nervosa, and I really hope I make the cutoff time this time because the last time I went over the 10 minutes. So basically, I'm just going to be talking today about the symptoms and characteristics of this disorder, as well as the prevalence, theories of origin, and the prevailing treatments for anorexia. So to start us off, I'm going to give you a brief rundown of what anorexia nervosa is, as well as what differentiates it from other major eating disorders. So anorexia is basically where you are restricting food intake at an unhealthy rate in order to lose body weight. It is constantly characterized by constant food refusal, and your main goal is to lose that inherent body weight. And this is actually kind of different from somebody with, let's say, for example, avoidant restrictive food intake disorder, otherwise known as ARFID, where somebody is limiting their food intake simply because they don't like food. So the inherent goal that differentiates between anorexia and this disorder is that anorexia is with the goal in mind of losing weight. And this is also different than like bulimia nervosa disorder because anorexia is strictly restricting or eating small amounts of food and then purging later, whereas bulimia is just binge, purge, binge, purge. So it's a constant back and forth. But after that, mainly what are the signs and symptoms of anorexia? So the main takeaway that differentiates between anorexia and bulimia is that anorexia, you are successful at losing weight. You are successful at losing weight to the point where you are actually at a dangerously low body weight. This can cause cessation of menstruation, hair loss, and a bunch of other detrimental body effects that can actually cause you to start shutting your organs down. But in bulimia, you're not as successful as losing that weight. And then somebody with anorexia is quite literally afraid of gaining weight or fluctuating body weight. It can cause intense panic and intense fear, and it stresses them out to the max, and they will do anything they can to offset weight gain. So that's just kind of like the key takeaways and the signs and symptoms that can show you somebody that has anorexia. So going off of this, there are two different subtypes of anorexia. The first is restricting type, which is where this is pretty much the more commonly known one, where individuals diet to limit intake. And the second type is the binge eating purging type, which is the less known type, not to be confused with bulimia nervosa. It's just where you are binging on very, very minuscule, small amounts of food, and you are purging more often, so more consistently. All right, and then the DSM-5 criteria, I'm obviously not going to read this word for word. This is just like a little PowerPoint that helps you like learn more from the textbook. But basically, you are just restricting energy intake relative to its requirements, meaning that you're not only just simply dieting, but it's so extreme to like your age, your gender, your developmental health, your physical health. It is very extreme in proportion to those characteristics, those aspects. And then you have an intense fear of gaining weight, like quite literally intense fear of gaining weight, like I talked about earlier. It's not just dieting to maybe lose a couple pounds in a healthy way, but you are terrified of gaining weight. And then lastly, there is a disturbance in the way that you perceive your own body, somebody else's body. You can literally be 80 pounds and you look at yourself in the mirror and you think that you are really fat when that is not true. So it is a very warped twist of reality, and you are not seeing yourself through the proper lens, if that makes sense. So going off of that, the prevalence of anorexia nervosa, so more like the lifetime prevalence is estimated to be around 0.6%, which does not sound like a lot, but in the national global grand scheme of things, that is a lot of people. And for males, it usually tends to be 0.3%. So you may think that women are the only people who develop disorder, and that's something that's more commonly known, but that is not true. Men are also vulnerable and susceptible to developing anorexia as well. And then women are estimated at 0.9%. So they tend to have more of societal and cultural dimensions that we'll talk about later that's placed upon them. And then there's a 12-month prevalence. So no respondents met the criteria for 12-month prevalence, just meaning that it tends to be more lifetime than it is just a 1-year diagnosis. So the gender and cultural statistics, just some key takeaways. If you see here the 1%, that just means that nobody has anorexia. And you can see white women start to taper off a little bit. They start getting more and more anorexia. Just some key takeaways. Western cultures are more likely to have anorexia nervosa than other cultures. And something that I found was interesting was that immigrants who originally didn't have anorexia and then they moved to Western cultures actually develop anorexia nervosa as a result of living in that societal atmosphere. And African women feel less pressure to lose weight than white women. And Western cultures, until recently, they've been pretty much up here in terms of diagnosis, and other countries have been down here. And they've kind of started to taper off and kind of meet more in the middle. And then the age of onset, typically, again, this is something that we see more often in adolescence because you feel the pressure to fit in, you feel the pressure to meet societal standards and not be bullied by others. The cases majority of the time tend to begin in adolescence, and this typically the age of onset typically occurs anywhere from 12 to 25 years. And it occasionally develops in children age 11, but you don't really see that often. Negative attitudes can actually start at 3 years old, which I thought was insane because you can barely perceive anything around you. But this is just basically, again, the cultural societal standards. That's like a repercussion of that. And then 55% of girls at age 12 are dieting, which is a crazy number for that age. And only 59%, so only a 4% jump of girls at age 22 are dieting. And then the course of anorexia, once it develops, its course tends to be chronic, but not as chronic as bulimia, which I found was interesting. And over a long period, people with anorexia, even in their recovery stages, tend to have low sense of self-esteem, very distorted sense of body weight, body shape, and a very low BMI. And then the theories of origin, again, like I've been talking about, social dimensions is huge when discussing an eating disorder because of the society that we live in. Movies, magazines, especially Instagram, Twitter, like Facetune, that has played a huge role, heavy on the Facetune, that really warps your sense of what is healthy and what is normal. And then psychological dimensions, of course, you have kind of two extremes where you're either trying to be a perfectionist and try to be skinny, perfect, thin, whatever you want to call it, or you have somebody that feels like they are very out of control in other aspects of their life. So they feel like the only aspect that they can control is their weight and is what they eat and how much that they eat. Then lastly, you have treatment methods. So the overarching goal for any treatment method, regardless of what you are trying to do, is weight restoration because you want them to return to that healthy weight, right? So over here in red, I have certain medications highlighted in red because medications actually haven't proved to be that effective, right? They generally, we have seen studies in the past with fluoxetine. They generally are not effective compared to other treatment methods. So the main one that is used most often is cognitive behavioral therapy, otherwise known as CBT, basically revamping how they see food and how they see body image and how they see others. So trying to change that behavior in their way of thinking towards food. And then a family focused approach is also generally effective when it comes to therapy, simply because we have talked about these social and psychological dimensions earlier. And being with family and taking a family approach towards battling anorexia has proven to be effective because you have other people trying to be there for you, working with you, and recentering those values. Okay, so enough yapping for me. That's it for this presentation project, and I hope you enjoyed. Thank you so much.